Standard operating procedure to contain spread of COVID-19 in offices. Offices in containment zones to remain closed except for medical and essential service. Specific preventive measures. Entrance to have mandatory sanitizer dispenser and thermal screening provisions. Only asymptomatic staff or visitors to be allowed. Officer and staff residing in containment zone to inform supervisory officer. Such staff to be permitted to work from home. Drivers to maintain social distancing and follow required do's and don'ts. Drivers residing in containment zones not to be allowed to drive vehicles. Provision for disinfection of the vehicle's interior using 1% sodium hypochlorite solution. Proper disinfection of steering, keys, etc. to be ensured. Employees at higher risk, that is, older employees, pregnant employees, etc., to take extra precautions. Work from home to be facilitated as feasible. All officers and staff or visitors to be allowed entry only if using face cover or masks and to be worn at all times inside office premises. Routine issues of visitors or temporary passes to be suspended, and visitors with proper permission to be allowed after being properly screened. Meeting, as far as feasible, should be done through video conferencing. Posters, standees, AV media on preventive measures about COVID-19 to be displayed in prominent places. Staggering of office hours, lunch hours to be done as far as feasible. Proper crowd management in parking lots and outside the premises, duly following social distancing norms to be ensured. Valet parking to be operational with operating staff wearing face covers, masks and gloves as appropriate. shops, stalls, cafeteria, etc., outside and within the office premises, to follow social distancing norms at all times. Specific markings may be made with sufficient distance to manage the queue and ensure social distancing in the premises. Preferably separate entry and exit for officers, staff, and visitors to be organized. Proper cleaning and frequent sanitization of the workplace, particularly of the frequently touched surfaces, to be ensured. Ensure regular supply of hand sanitizers, soap, and running water in the washrooms. Required precautions while handling supplies, inventories, and goods to be ensured. Seating arrangement to be made following adequate social distancing norms. Number of people in elevators to be restricted, duly maintaining social distancing norms. For AC or ventilation, guidelines of CPWD to be followed. All AC devices to be in the range of 24 to 30 degrees Celsius. Relative humidity to be in the range of 40 to 70%. Intake of fresh air to be as much as possible with adequate cross ventilation. Large gatherings continue to remain prohibited. Effective and frequent sanitization within the premises to be maintained with particular focus on lavatories, drinking and hand washing stations. Cleaning and regular disinfection using 1% sodium hypochlorite of frequently touched surfaces, doorknobs, elevator buttons, washroom fixtures, etc., to be done in the office premises and in common areas. Proper disposal of leftover face covers, masks, gloves to be ensured. In the cafeteria, canteen, dining halls. Adequate crowd and Queue management to be ensured following social distancing norms. Large gatherings continue to remain prohibited. Effective and frequent sanitization within the premises to be maintained with particular focus on lavatories, drinking and hand washing stations. Cleaning and regular disinfection using 1% sodium hypochlorite of frequently touched surfaces, doorknobs, elevator buttons, washroom fixtures, etc., to be done in the office premises and in common areas. Measures to be taken on occurrence of cases. When one or few persons who shared a room, close office space, is are found to be suffering from symptoms suggestive of COVID-19, place the ill person in a room or area where they are isolated from others at the workplace. Provide a mask or face cover till such time he or she is examined by a doctor. Immediately inform the nearest medical facility, hospital or clinic, or call the state or district helpline. A risk assessment to be undertaken by the designated public health authority, district RRT or treating physician, and accordingly further advice shall be made regarding management of case, his or her contacts and need for disinfection. The suspect case, if reporting very mild or mild symptoms on assessment by the health authorities, would be placed under home isolation. Suspect case, if assessed by health authorities as moderate to severe, will be treated as per health protocol in appropriate health facility. The rapid response team of the concerned district shall be requisitioned and will undertake the listing of contacts. The necessary action for contact tracing and disinfection of workplace will start once the report of the patient is positive. The report will be expedited for this purpose. Management of contacts. The contacts will be categorized into high and low risk contacts by the district rapid response teams. The high risk exposure contacts shall be quarantined for 14 days. These persons shall undergo testing as per ICMR protocol. The low risk exposure contacts shall continue to work and closely monitor their health for next 14 days. Closure of workplace. If one or two cases reported, disinfection procedure to be limited to areas visited by the patient in past 48 hours. No need to close the entire office building and work can be resumed after disinfection. In case of larger outbreak, the building to be closed for 48 hours after thorough disinfection. All the staff will work from home till the building is adequately disinfected. Disinfection procedures in offices. Detailed guidelines on disinfection issued by Health Ministry to be followed.